Welcome to the NHA Phlebotomy Exam Study Guide, your path to NHA certification. Whether you're just starting your journey in phlebotomy, looking to sharpen your skills, or preparing for your NHA certification, this is the perfect place to start. In this video, we'll cover all the essentials of phlebotomy, including best practices, practical techniques, and exam tips to ensure you're fully prepared. After each chapter, we've included a Q&A section to help solidify your understanding. For the ultimate prep experience, check the description to access the Audible version, the free exam prep guide, or the Amazon link for the book. Don't forget to like and subscribe for more exam resources and updates. Now, here's your instructor to guide you on this path to certification.
Number 1. Which component is crucial for establishing trust in patient-phlebotomist interactions? A. Quick completion of procedure. B. Technical proficiency alone. C. Effective communication. And D. Wearing appropriate attire. The answer is C. Effective communication. Number 2. Which of the following is essential in maintaining patient confidentiality? A. Discussing patient information in a public area. B. Sharing patient results with family. C. Using patient's full name in a crowded area. And D. Keeping patient information secure and disclosed only to authorized personnel. The answer is D. Keeping patient information secure and disclosed only to authorized personnel. Number 3. What is the significance of obtaining informed consent from the patient? A. It is optional and not necessary. B. It legally and ethically involves the patient in decision-making process. C. It is only necessary for complicated procedures. And D. It is a formality, carries no legal weight. The answer is B. It literally and ethically involves the patient in the decision-making process. Number 4. How should a phlebotomist handle communication with pediatric patients? A. Use medical jargon for accuracy. B. Communicate only with a guardian or parent. C. Use a friendly, calm, and reassuring approach. D. Treat them exactly as you would treat an adult patient. The answer is C. Use a friendly, calm, and reassuring approach. Number 5. Which of the following scenarios is in adherence with the HIPAA regulations? A. Discussing patient's condition with a colleague in the elevator. B. Leaving patient records open and unattended on a computer. C. Verifying the patient's identity using 2 identifiers. And D. Sharing patient information with friends or family without consent. The answer is C. Verifying the patient's identity using 2 identifiers. Number 6. Which of the following is a method of nonverbal communication in phlebotomy? A. Email communication. B. Using medical terminologies. C. Eye contact. Or D. Explaining the procedure. The answer is C. Eye contact. Number 7. What is the main goal of patient identification? A. Quick completion of the procedure. B. Ensuring the right test is conducted. C. Ensuring that the collected sample corresponds to the correct patient. And D. Making the patient feel comfortable. The answer is C. Ensuring that the collected sample corresponds to the correct patient. Number 8. Which of the following is crucial for a phlebotomist to wear during a procedure? A. Casual attire. B. Personal jewelry. C. Perfume or strong scents. D. Proper personal protective equipment, PPE. The answer is D. Proper personal protective equipment, PPE. Number 9. Which action demonstrates a respect for a patient's cultural beliefs? A. Ignoring them, treating every patient the same. B. Insisting on the standard procedure without flexibility. C. Adapting procedure where possible to accommodate beliefs. D. Asking intrusive questions out of curiosity. The answer is C. adapting procedure where possible to accommodate beliefs. Number 10. In which scenario is a phlebotomist most likely to face legal consequences? A. When they accurately label the samples. B. When they explain the procedure thoroughly to the patient. C. When they fail to obtain informed consent. When they use two patient identifiers for verification. The answer is C. When they have failed to obtain informed consent. Number 11. What should a phlebotomist prioritize when communicating with elderly patients? A. Speak louder and faster. B. Use complicated medical terminologies. C. Display patience and speak clearly. Or D. Focus only on technical aspects of the procedure. The answer is C. Display patience and speak clearly. Number 12. Which is a common error in the patient identification process? A. Using two unique identifiers. B. Verifying the name and date of birth. C. Using room number as an identifier. Or D. Asking open-ended questions for verification. The answer is C. Using room number as an identifier. Number 13. How should phlebotomists manage anxious or nervous patients? A. Ignore their anxiety, focusing only on the procedure. B. Show empathy and calmly explain the procedure. C. Rush the procedure to minimize the patient's anxiety. Or D. Avoid talking to reduce anxiety triggers. The answer is B. Show empathy and calmly explain the procedure. Number 14. Which is an essential aspect of post-procedure patient interaction? A. Quickly leave the room. B. Ensuring the patient feels comfortable and answering any questions. C. Ignoring any signs of discomfort from the patient. Or D. Not providing post-care instructions. The answer is B. Ensuring the patient feels comfortable and answering any questions. Number 15. What is a vital skill for effective patient communication in phlebotomy? A. Using complicated medical jargon. B. Active listening. C. Talking extensively without pauses. D. Avoiding direct eye contact. The answer is B. Active listening. Number 16. What information is essential to communicate to the patient before starting the phlebotomy procedure? A. Only the possible complications. B. Nothing. Patients prefer not to know. C. The purpose, process, and any potential discomfort associated with the procedure. Or D. Only information about the post-procedure care. The answer is C. The purpose, process, and any potential discomfort associated with the procedure. Number 17. Which of the following indicates a violation of patient confidentiality? A. Discussing patient information in a secured private area. B. Sharing patient information on social media. C. Using coded identifiers for patient samples. Or D. Verifying patient identity before discussing health information. The answer is B. Sharing patient information on social media. Number 18. Which technique is best for dealing with difficult or uncooperative patients? A. Arguing with the patient. B. Remaining calm and professional. C. Ignoring the patient's concerns. D. Rushing the procedure to end the interaction quickly. The answer is B. Remaining calm and professional. Number 19. What should you do if a patient refuses a phlebotomy procedure? A. Proceed anyway. The patient's consent is not necessary. B. Use force to ensure the necessary samples are taken. C. Respect the patient's wishes and inform the necessary healthcare personnel. And D. Convince the patient that their opinion is wrong. The answer is C. Respect the patient's wishes and inform the necessary healthcare personnel. Number 20. How can phlebotomists ensure effective communication with patients who have hearing impairments? A. Ignore the impairment and proceed as usual. B. Speak loudly and quickly. C. Use visual aids, gestures, and ensure the environment is well lit. D. Avoid communicating important information to avoid difficulties. The answer is C. Use visual aids, gestures, and ensure the environment is well lit. Number 21. What is the role of empathy in patient-phlebotomist interactions? A. It is not important. Technical skills are all that matter. B. It helps in understanding the patient's feelings and concerns. C. It is only necessary for pediatric patients. And D. It complicates the interactions by making it too emotional. The answer is B. It helps in understanding the patient's feelings and concerns. Number 22. Which of the following best describes informed consent? A. Getting approval from the patient's family members. B. A signature on a form without explaining the procedure. C. A formal agreement after explaining the procedures and potential risks. D. Only necessary for complicated and risky procedures. The answer is C. A formal agreement after explaining the procedure and potential risks. Number 23. Which action shows respect for a patient's autonomy in decision-making? A. Making the decisions on behalf of the patient without consultation. B. Ignoring the patient's questions and concerns. C. Providing comprehensive information and respecting the patient's choices. D. Rushing the explanation to expedite the decision-making process. The answer is C. Providing comprehensive information and respecting the patient's choices. Number 24. What is essential for effective communication with multicultural patients? A. Using medical jargon to ensure accuracy. B. Being mindful of cultural sensitivities and language barriers. C. Assuming all patients have similar cultural beliefs and understanding. Or D. Focusing only on the technical aspects of communication. The answer is B. Being mindful of cultural sensitivities and language barriers. Number 25. How should a phlebotomist manage a situation where a patient is feeling dizzy during a blood draw? A. Leave the patient alone to recover. B. Continue the blood draw, regardless of the patient's condition. C. Ensure the patient is safe, stop the procedure if necessary, and seek assistance. D. Ask the patient to hurry up and finish the procedure quickly. The answer is C. Ensure the patient is safe, stop the procedure if necessary, and seek assistance. Number 26. In which scenario is it appropriate to share a patient's health information? A. When a family member asks casually. B. In a social gathering with friends. C. When required for coordinated health care with proper authorization. Or D. On social media to get advice from peers. The answer is C. When required for coordinated health care with proper authorization. Number 27. How should phlebotomists respond to a patient who has questions about their lab results? A. Provide a detailed interpretation of the results. B. Refer the patient to their healthcare provider for explanation. C. Ignore the question, change the topic. D. Share personal opinions and judgments about the result. The answer is B. Refer the patient to their healthcare provider for explanation. Number 28. Which action best demonstrates patient-centered care in phlebotomy? A. Rushing through the procedures to manage time. B. Ignoring the emotional and psychological needs of the patient. C. Tailoring communication and care according to the individual needs of the patient. D. Treating all patients with a one-size-fits-all approach. The answer is C. Tailoring communication and care according to the individual needs of the patient. Number 29. How can phlebotomists manage language barriers in patient communication? A. Use only medical terminology to maintain professionalism. B. Utilize translation services or tools to facilitate accurate communication. C. Speak louder and slower to ensure understanding. D. ignore the barrier and proceed with the procedure without communication? The answer is B. Utilize translation services or tools to facilitate accurate communication. Number 30. Which statement reflects the importance of communication skills in phlebotomy? A. They are as crucial as technical skills for patient care and satisfaction. B. They are unnecessary as long as the phlebotomist is technically competent. D. They are only necessary for dealing with difficult patients. And D. They are less important than speed and efficiency in procedures. The answer is A. They are as critical as technical skills for patient care and satisfaction. Number 31. Which action promotes a comfortable and reassuring environment for the patient during phlebotomy? A. Rushing to finish quickly. B. Ignoring the patient's emotional state. C. Engaging in friendly and empathetic communication. Or D. Avoiding conversation with the patient. The answer is C. Engaging in friendly and empathetic communication. Number 32. What is an appropriate way to confirm a patient's identity? A. Asking the patient's name only. B. Using the patient's bed or room number. C. Checking the patient's wristband and asking for verbal confirmation. Or D. Calling the patient's name in a waiting area. The answer is C. Checking the patient's wristband and asking for verbal confirmation. Number 33. Which is a sign of effective communication in phlebotomy? A. The patient seems anxious and confused. B. The patient has an opportunity to ask questions and receive clear answers. C. The patient receives only technical information without any reassurance. And D. The patient is rushed through the procedure without time for questions. The answer is B. The patient has an opportunity to ask questions and receive clear answers. Number 34. How should phlebotomists handle patients who are fearful of needles? A. Tell them their fear is irrational. B. Show irritation to encourage them to cooperate. C. Demonstrate empathy and gently explain the process to help alleviate their fears. Or D. Ignore their fears and proceed as quickly as possible. The answer is C. Demonstrate empathy and gently explain the process to help alleviate their fears. Number 35. How can phlebotomists maintain patient dignity during procedures? A. By exposing only the necessary areas for the procedure and ensuring privacy. B. By ignoring the patient's preferences and comfort. C. By conducting the procedure in a public or semi-public area. Or D. By discussing the patient's health information openly. The answer is A. By exposing only the necessary areas for the procedure and ensuring privacy. Number 36. What is an important consideration when communicating with a pediatric patient? A. Using a stern and authoritative tone. B. Using language that is age-appropriate and engaging. C. Ignoring the child's questions or concerns. D. Only speaking with a parent or guardian. The answer is B. Using language that is age-appropriate and engaging. Number 37. Which of the following best practices enhances the accuracy and reliability of patient identification? A. Using a single identifier, such as the patient's name. B. Relying on memory and familiar faces. C. Using at least 2 patient identifiers, such as name and date of birth. Or D. Asking the patient to identify themselves without verification. The answer is C. Using at least 2 patient identifiers, such as name and date of birth. Number 38. What is a fundamental ethical consideration in patient-phlebotomist interactions? A. Prioritizing efficiency over patient comfort. B. Respecting patient autonomy and informed consent. D. Discussing the patient's condition with interested third parties. D. Focusing only on the technical aspects of the procedure. The answer is B, respecting patient autonomy and informed consent. Number 39. How should a phlebotomist address a patient's questions about the necessity of a blood draw? A. Dismiss the question as irrelevant. B. Provide a thorough explanation clarifying the purpose and importance of the test. C. Direct them to ask someone else, avoiding the question. Or D. Give a generic response without specific information. The answer is B. Provide a thorough explanation clarifying the purpose and importance of the test. Number 40. What approach should a phlebotomist take when a patient expresses discomfort or pain during a procedure? A. Ignore the expression and continue. B. Show annoyance to discourage further expressions of discomfort. C. Pause and address the patient's concerns with empathy and care. Or D. Hurry to finish the procedure without acknowledging the discomfort. The answer is C. Pause and address the patient's concern with empathy and care. Number 41. Which action demonstrates adherence to professional boundaries in patient interactions? A. Sharing personal problems with the patient. B. Accepting personal gifts from the patient. C. Maintaining a focus on the patient's care and well-being. Or D. Establishing friendships with patients outside of the professional setting. The answer is C. Maintaining a focus on the patient's care and well-being. Number 42. How can phlebotomists effectively communicate with patients who have limited health literacy? A. Use complex medical terminology to maintain professionalism. B. Provide information in a clear, straightforward manner using layman's terms. C. Overload them with information, assuming they will understand. D. Limit information sharing to avoid confusing the patient. The answer is B. Provide information in a clear, straightforward manner using layman's terms. Number 43. How should phlebotomists manage potential language barriers in patient communication? A. Speak only in English, regardless of the patient's understanding. B. Use gestures and body language only to communicate essential information. C. Employ translation services or bilingual staff members to facilitate communication. D. Avoid detailed communication to prevent misunderstandings. The answer is C. Employ translation services or bilingual staff members to facilitate communication. Number 44. Which action contributes to a positive and respectful patient-phlebotomist relationship? A. Dismissing the patient's feelings and concerns. B. Demonstrating empathy, active listening, and effective communication. C. Focusing solely on the technical aspects of the blood draw. Or D. Rushing the procedure to accommodate more patients. The answer is B. Demonstrating empathy, active listening, and effective communication. Number 45. What is a critical aspect of obtaining informed consent for phlebotomy procedures? A. Getting a signature as quickly as possible. B. Ensuring the patient has a comprehensive understanding of the procedure, risks, and benefits. C. Providing minimal information to avoid overwhelming the patient. Or D. Prioritizing the consent form over verbal explanations and discussion. The answer is B. Ensuring the patient has a comprehensive understanding of the procedure, risks, and benefits. Number 46. In the context of phlebotomy, what does HIPAA primarily safeguard? A. The phlebotomist's personal information. B. The operational details of the healthcare facility. C. The patient's protected health information, PHI. Or D. General information that is not patient-specific. The answer is C. The patient's protected health information, PHI. Number 47. Which strategy enhances effective communication with an elderly patient during phlebotomy? A. Speaking rapidly and using complex terminology. B. Demonstrating patience, speaking clearly, and active listening. C. Minimizing communication to expedite the process. D. Treating them exactly as one would treat a younger adult. The answer is B. Demonstrating patience, speaking clearly, and active listening. Number 48. What should a phlebotomist prioritize when communicating the potential risks of a procedure to a patient? A. Avoid mentioning risks to prevent causing anxiety. B. Provide detailed statistics on every possible risk. C. Communicate clearly, honestly, and in a reassuring manner. D. Focus only on the most severe potential complications. The answer is C. Communicate clearly, honestly, and in a reassuring manner. Number 49. When is it acceptable to breach patient confidentiality in phlebotomy? A. When talking to friends or family. B. In discussions with unauthorized colleagues. C. When discussing patient cases in public areas. Or D. In situations mandated by law, such as reporting specific communicable diseases. The answer is D. In situations mandated by law, such as reporting specific communicable diseases. Number 50. Which of the following is essential for promoting patient care and cooperation during a blood draw procedure? A. Having a detached and purely technical approach. B. Displaying empathy and explaining procedures and answering questions. C. Ignoring the patient's need for information and reassurance. Or D. Conducting the procedure as quickly as possible without explanation. The answer is B. Displaying empathy, explaining procedures, and answering questions. Number 51. Which phrase best describes the term therapeutic communication in phlebotomy? A. Communicating only medical facts and figures. B. Using communication to enhance the patient's comfort and understanding. C. Limiting communication to procedural aspects only. Or D. Avoiding any form of communication to prevent errors. The answer is B. Using communication to enhance the patient's comfort and understanding. Number 52. When is it most appropriate to educate the patient about the aftercare of the phlebotomy site? A. Only if the patient asks. B. Before starting the phlebotomy procedure. C. During the needle insertion. Or D. After the procedure is completed, before the patient leaves. The answer is D. After the procedure is completed, before the patient leaves. Number 53. How can a phlebotomist make a pediatric patient more comfortable during a blood draw? A. By ignoring the child's fears or questions. B. By engaging in age-appropriate conversation and using a gentle approach. C. By asking the patient not to look and remain silent. D. By performing the procedure as quickly as possible without any interaction. The answer is B. By engaging in age-appropriate conversation and using a gentle approach. Number 54. What should a phlebotomist do if a patient seems unsure or hesitant about a procedure? A. Proceed without addressing the patient's concerns. B. Offer a detailed explanation and answer any questions the patient may have. C. Persuade the patient to comply without providing further information. Or D. Ask the patient to seek another phlebotomist or facility. The answer is B. Offer a detailed explanation and answer any questions the patient may have. Number 55. Which practice demonstrates respect for patient confidentiality during phlebotomy procedures? A. Discussing patient information openly at the reception desk. B. Using coded language when discussing patient cases in common areas. C. Sharing interesting patient cases with friends or family. Or D. Conducting private conversations with patients in enclosed spaces. The answer is D. Conducting private conversations with patients in enclosed areas. Number 56. How should phlebotomists manage patients who exhibit signs of anxiety or nervousness? A. Dismiss their feelings as irrelevant to the procedure. B. show irritation to discourage expressions of anxiety. C. Demonstrate understanding, offer reassurance, and maintain a calm demeanor. D. Rush through the procedure to minimize the time the patient feels anxious. The answer is C. Demonstrate understanding, offer reassurance, and maintain a calm demeanor. Number 57. Which action is essential for maintaining professional integrity in phlebotomy? A. Developing personal relationships with patients. B. Engaging in gossip about patient cases. C. Consistently adhering to ethical guidelines and best practices. D. Sharing minimal information about procedures to expedite the process. The answer is C. Consistently adhering to ethical guidelines and best practices. Number 58. How should a phlebotomist handle a question from a patient that falls outside their expertise or scope of practice? A. Guess the answer to avoid appearing uninformed. B. Refer the patient to a relevant healthcare professional or source for accurate information. C. Provide a generic answer without confirming its accuracy. Or D. Ignore the question and redirect the conversation. The answer is B. Refer the patient to a relevant healthcare professional or source for accurate information. Number 59. What approach should be prioritized when interacting with a patient who has cognitive impairments? A. Using complex medical jargon. B. Displaying impatience and irritation. C. Communicating clearly, patiently, and respectfully, and verifying understanding. D. Limiting interaction and communicate to the bare minimum. The answer is C. Communicating clearly, patiently, and respectfully, and verifying understanding. Number 60. Which statement is true regarding informed consent in phlebotomy? A. Verbal consent is unnecessary. Written consent is always required. B. It is obtained after the procedure is completed. C. It involves ensuring the patient understands the procedure, its purpose, and potential risks. And D. It is only required for patients who seem unsure about the procedure. The answer is C. It involves ensuring the patient understands the procedure, its purpose, and potential risks. Number 61. Which action contributes to building trust with a patient during a phlebotomy procedure? A. Not allowing the patient to ask questions. B. Demonstrating competency and professionalism. C. Ignoring the patient's comfort levels. And D. Focusing solely on the technical aspects of the procedure. The answer is B. Demonstrating competency and professionalism. Number 62. How should a phlebotomist respond when a patient asks about the results of a previous blood test? A. Provide a detailed interpretation of the results. B. Politely refer the patient to their physician for a detailed explanation. C. Ignore the question and continue with the procedure. D. Discuss the results openly in a crowded waiting area. The answer is B. Politely refer the patient to their physician for a detailed explanation. Number 63. What is an essential part of preparing a patient psychologically for a phlebotomy procedure? A. Providing clear and concise information about what to expect. B. Asking the patient not to express pain or discomfort. C. Focusing on the negative aspects of the procedure. Or D. Not allowing the patient time to ask questions. The answer is A. Providing clear and concise information about what to expect. Number 64. How can a phlebotomist enhance the patient's understanding and compliance during informed consent? A. By using medical jargon and technical terms. B. By rushing through the consent to save time. C. By encouraging questions and answering them clearly. Or D. By obtaining consent without explaining the procedure's purpose or risks. The answer is C. By encouraging questions and answering them clearly. Number 65. Which approach is effective in managing difficult or uncooperative patient during phlebotomy? A. demonstrating frustration and impatience. B, using a stern and authoritarian communication style. C, maintaining calm, demonstrating empathy, and using effective communication. Or D, ignoring the patient's concern and proceeding quickly with the procedure. The answer is C, maintaining calm, demonstrating empathy, and using effective communication. Number 66. Which of the following promotes a respectful and empathetic patient-phlebotomist interaction? A, minimizing verbal communication to avoid mistakes. B, treating patients uniformly without considering individual needs or feelings. C, actively listening and responding to the patient's questions or concerns. Or D, prioritizing speed and efficiency over patient communication and comfort. The answer is C, actively listening and responding to the patient's questions or concerns. Number 67. What is an appropriate way for a phlebotomist to handle patients' fear or anxiety about pain during the procedure? A, dismissing their concerns as irrelevant. B, assuring them that the procedure is entirely painless. C, explaining that a slight discomfort might be felt and they are there to help manage it. D, not addressing pain unless the patient expresses significant discomfort. The answer is C, explaining that a slight discomfort might be felt and that they are there to help manage it. Number 68. How can phlebotomists effectively handle language barriers with patients? A, using a family member as a consistent interpreter. B, utilizing professional interpreter services when necessary. C, speaking louder and slower in English. D, avoiding important information to prevent misunderstanding. The answer is B, utilizing professional interpreter services when necessary. Number 69. What should be prioritized when communicating with patients about the phlebotomy procedure? A, the phlebotomist's personal experiences with phlebotomy. B, detailed technical aspects of the blood draw. C, clear, patient-centered, and understandable explanations. Or D, information that is only relevant in complex cases. The answer is C, clear, patient-centered, and understandable explanations. Number 70. Which of the following is a key component of effective communication with a patient before beginning a phlebotomy procedure? A, providing all potential details, including rare complications. B, rushing through explanations to expedite the procedure. C, ensuring the patient has a basic understanding of the procedure and its purpose. Or D, focusing only on the risks without explaining the benefits. The answer is C, ensuring the patient has a basic understanding of the procedure and its purpose. Number 71. What kind of language should a phlebotomist use to ensure clear communication with patients? A, medical jargon to show expertise. B, complicated terminology to avoid oversimplification. C, simple plain language to facilitate understanding. Or D, convoluted explanations to cover all potential questions. The answer is C, simple plain language to facilitate understanding. Number 72. How should a phlebotomist manage a patient who seems faint during a blood draw? A, continue the procedure without acknowledging the patient's discomfort. B, stop the procedure, ensure the patient is safe, and seek necessary assistance. C, advise the patient to endure the discomfort until the procedure is over. D, leave the patient momentarily to fetch assistance without prior communication. The answer is B, stop the procedure, ensure the patient is safe, and seek medical assistance. Number 73. What should a phlebotomist primarily focus on when interacting with elderly patients? A, completing the procedure as swiftly as possible. B, demonstrating patience, ensuring comfort, and communicating clearly. C, not allowing the patient to ask questions to avoid confusion. D. Treating them identically to younger patients without any modifications. The answer is B. Demonstrating patience, ensuring comfort, and communicating clearly. Number 74. Which technique aids in achieving successful venipuncture in a highly anxious patient? A. Performing the procedure as quickly as possible without explanation. B. Engaging in calming conversation and employing relaxation techniques. C. Avoiding any conversation that does not pertain to the procedure. And D. Asking the patient to manage their anxiety without offering assistance. The answer is B. Engaging in calming conversation and employing relaxation techniques. Number 75. How should a phlebotomist handle an instance where they are uncertain about a certain procedure or guideline? A. Proceed with their best guess to avoid embarrassment. B. Consult a knowledgeable colleague or supervisor for guidance. C. Ignore the uncertainty and continue on as per usual protocols. And D. Avoid the situation by assigning the task to another colleague. The answer is B. Consult a knowledgeable colleague or supervisor for guidance. Number 76. Which approach fosters a sense of patient autonomy during the consent process of phlebotomy? A. Rushing the patient to make a decision. B. Ensuring the patient has sufficient information to make an informed choice. C. Making the decision on behalf of the patient. D. Discouraging any questions or clarifications from the patient. The answer is B. Ensuring the patient has sufficient information to make an informed choice. Number 77. What action should a phlebotomist take when faced with a patient's refusal for a blood draw? A. Proceed with the draw regardless of the patient's wishes. B. Use coercion to convince the patient. C. Respect the patient's wishes and inform the relevant healthcare professional. D. Insist repeatedly until the patient gives in. The answer is C. Respect the patient's wishes and inform the relevant healthcare professional. Number 78. In what way should the phlebotomist maintain professionalism when a patient expresses anger or frustration? A. Respond with equal anger and defensiveness. B. Dismiss the patient's feeling as irrelevant. C. Maintain composure, listen empathetically, and address the issue calmly. D. Avoid engaging with the patient and complete the procedure hurriedly. The answer is C. Maintain composure, listen empathically, and address the issue calmly. Number 79. Which of the following is true regarding the communication of lab results to a patient? A. Phlebotomists should provide detailed explanations and interpretations. B. Phlebotomists should refer the patient to their ordering physician for results. C. Phlebotomists are responsible for diagnosing based on lab results. And D. Phlebotomists should discuss results openly in the presence of others. The answer is B. Phlebotomists should refer the patient to their ordering physician for results. Number 80. How should a phlebotomist handle a situation where a patient is asking numerous questions, causing delay? A. Ignore the questions and proceed. B. Answer the questions quickly without much explanation. C. Address the questions patiently and thoroughly to ensure patient understanding. D. Inform the patient that questions are not allowed during the procedure. The answer is C. Address the questions patiently and thoroughly to ensure patient understanding. Number 81. How should a phlebotomist ensure that information is communicated effectively to a non-English speaking patient? A. Use a reliable medical interpretation service. B. Speak louder and slower in English. C. Use hand gestures to convey the message. D. Ask another patient to translate. The answer is A. Use a reliable medical interpretation service. Number 82. Which action promotes a patient-friendly environment in the phlebotomy service area? A. Avoiding direct eye contact with the patient. B. Keeping the area organized, clean, and welcoming. C. Limiting conversation with patients to medical matters only. D. Ignoring patient comfort to expedite the procedure. The answer is B. Keeping the area organized, clean, and welcoming. Number 83. How should phlebotomists manage negative emotions or stress during patient interactions? A. Express their frustrations openly to vent. B. Maintain professionalism and manage emotions constructively off-duty. C. Allow emotions to influence interactions with subsequent patients. D. Seek sympathy from patients to feel better. Answer is B. Maintain professionalism and manage emotions constructively off-duty. Number 84. What is the role of empathy in patient-phlebotomist interactions? A. It is unnecessary, as it doesn't impact the procedure's outcome. B. It helps in understanding and addressing the patient's feelings and concerns. C. It is discouraged, as it consumes too much time. D. It is only applicable when dealing with pediatric or elderly patients. The answer is B. It helps in understanding and addressing the patient's feelings and concerns. Number 85. Which of the following actions aligns with maintaining patient dignity during phlebotomy procedures? A. Conducting procedures in a hurried manner. B. Ensuring privacy and confidentiality during patient interactions. C. Discouraging patients from expressing their feelings or concerns. D. Discussing patient cases and details openly in the common areas. The answer is B. Ensuring privacy and confidentiality during patient interactions. Number 86. What communication approach is recommended when handling patients with mental health challenges? A. Using technical jargon to sound professional. B. Being curt and direct to avoid lengthy conversations. C. Demonstrating patience, understanding, and respect in interactions. And D. Avoiding any form of nonverbal communication for simplicity. The answer is C. Demonstrating patience, understanding, and respect in interactions. Number 87. Which action demonstrates effective active listening in patient communications? A. Interrupting the patient to hasten the conversation. B. Providing solutions immediately without letting the patient finish speaking. C. Nodding and responding appropriately to show engagement. Or D. Disregarding the patient expressions that seem irrelevant to the procedure. The answer is C. Nodding and responding appropriately to show engagement. Number 88. How should a phlebotomist respond to a patient's questions about the laboratory accuracy and reliability? A. Dismiss the question as irrelevant. B. Provide honest information and reassure the patient of the lab's commitment to quality. C. Discourage further questions about the laboratory operations. D. Exaggerate statistics to offer excessive reassurance. The answer is B. Provide honest information and reassure the patient of the lab's commitment to quality. Number 89. How can a phlebotomist handle misunderstandings or misconceptions a patient has about a procedure? A. Correct the misinformation by providing clear and accurate explanations. B. Ignore the misunderstanding to avoid conflict. C. Agree with the patient to avoid causing discomfort. And D. Offer overly detailed information to overwhelm the patient. The answer is A. Correct the misinformation by providing clear and accurate explanations. Number 90. What is a critical consideration when communicating with family members or caregivers of a patient? A. Ensuring the patient's confidentiality is maintained unless consent is given. B. Sharing detailed medical information freely to keep them informed. C. Disregarding the patient's wishes in favor of family opinions. And D. Encouraging family members to make decisions without patient consent. The answer is A. Ensuring the patient's confidentiality is maintained unless consent is given. Number 91. What should a phlebotomist prioritize during patient identification? A. Speed of the identification process. B. Verifying at least 2 patient identifiers. C. Relying solely on a bed or room numbers. Or D. Asking the patient to identify themselves without cross-verification. The answer is B. Verifying at least 2 patient identifiers. Number 92. How should information be communicated to a patient with hearing impairment? A. Speaking louder to ensure they hear. B. Using visual aids and written instructions. C. Ignoring the impairment and communicating as usual. D. Relying solely on family members to convey information. The answer is B. Using visual aids and written instructions. Number 93. Which behavior exemplifies professionalism in patient interactions? A. Sharing personal problems with patients. B. Maintaining patient confidentiality. C. Gossiping about other healthcare professionals. Or D. Discussing other patients with a patient. The answer is B. Maintaining patient confidentiality. Number 94. Which action demonstrates respect for a patient's cultural beliefs? A. Imposing one's belief on the patient. B. Ignoring or dismissing cultural practices or beliefs. C. Adapting care approaches to be culturally sensitive. Or D. Discouraging discussion about cultural practices. The answer is C. Adapting care approaches to be culturally sensitive. 95. How should a phlebotomist manage a patient's nonverbal cues of discomfort or anxiety? A. Disregard them and focus solely on the procedure. B. Acknowledge and address them through empathetic communication. C. Discourage any expression of discomfort or anxiety. D. View them as irrelevant if the patient does not verbally complain. The answer is B. Acknowledge and address them through empathetic communication. Number 96. How can a phlebotomist effectively communicate with pediatric patients? A. Using age-appropriate language and a gentle approach. B. Treating them the same as adult patients. C. Avoiding direct communication to reduce anxiety. D. Providing detailed technical explanations of the procedure. The answer is A. Using age-appropriate language and a gentle approach. Number 97. What is a crucial aspect of post-procedure communication with a patient? A. Providing them aftercare instructions. B. Rushing the patient out of the room. C. Avoiding any further conversation. Or D. Encouraging the patient not to discuss the procedure. The answer is A. Providing aftercare instructions. 98. How should a phlebotomist approach a patient who appears to be agitated or upset? A. With calmness, empathy, and willingness to listen. B. With impatience and a dominating attitude. C. By ignoring the patient's emotional state. And D. By postponing the procedure indefinitely. The answer is A. With calmness, empathy, and a willingness to listen. Number 99. Which approach should be taken when a patient asks a question beyond the phlebotomist's scope of practice? A. Providing a speculative answer. B. Politely directing the patient to the appropriate healthcare professional. C. Dismissing the question as inappropriate. And D. Pretending to have knowledge and providing an answer. The answer is B. Politely directing the patient to the appropriate healthcare professional. Number 100. Which of the following is a guideline for maintaining patient privacy during phlebotomy procedures? A. Discussing patient information openly in the common areas. B. Leaving the patient files and results visible to others. C. Using curtains or private rooms when available. And D. Confirming patient identity loudly in a waiting room. The answer is C. Using curtains or private rooms when available. 101. What strategy can facilitate better communication with a patient who is elderly and frail. A. Rushing the procedure to reduce their discomfort. B. Speaking loudly, assuming they have a hearing impairment. C. Demonstrating patience, speaking clearly, and allowing time for responses. D. Limiting communication to reduce confusion. The answer is C. Demonstrating patience, speaking clearly, and allowing time for responses. Number 102. How should a phlebotomist address a patient's misconception or fears about venipuncture? A. By providing clear, factual information and reassurance. B. By dismissing their fears as irrational. C. By agreeing with their misconceptions to avoid conflict. Or D. By avoiding the discussion of fears or misconceptions. The answer is A. By providing clear, factual information and reassurance. Number 103. Which statement reflects a patient-centered approach in phlebotomy? A. We prioritize completing procedures quickly to serve more patients. B. Patient comfort and understanding are central to our care approach. C. Patients should adapt to our established routines and procedures. Or D. Our main focus is technical accuracy, not patient communication. The answer is B. Patient comfort and understanding are central to our care approach. Number 104. When is it appropriate for a phlebotomist to share details about a patient's status or test results? A. When asked by the patient's family or friends. B. When discussing with other staff in a non-private setting. C. Only when necessary with authorized personnel, ensuring privacy. D. During casual conversations outside of the work environment. The answer is C. Only when necessary with authorized personnel, ensuring privacy. 105. What communication techniques can be helpful when dealing with an anxious patient? A. Using medical terminology to sound more professional. B. Offering a detailed description of every step in the phlebotomy process. C. Providing concise, calming explanations and allowing space for questions. D. Avoiding conversation to complete the procedure quickly. The answer is C. Providing concise, calming explanations and allowing space for questions. Number 106. Which action best demonstrates a phlebotomist's commitment to patient safety? A. Performing procedures as quickly as possible. B. Double-checking patient identification and test orders. C. Prioritizing ease and convenience over procedural accuracy. And D. Ignoring minor mistakes or discrepancies in patient information. The answer is B. Double-checking patient identification and test orders. Number 107. What is the key consideration in obtaining informed consent from a patient? A. Ensuring that the patient has a basic understanding of the procedure and its risks. B. Getting the consent form signed as quickly as possible. C. Discouraging the patient from asking questions. And D. Providing excessive details that may confuse the patient. The answer is A. Ensuring the patient has a basic understanding of the procedure and its risks. 108. Which scenario necessitates the use of a professional interpreter? A. When the patient speaks a different language and there's a significant communication barrier. B. When the patient has a slight accent but can accommodate effectively in English. C. When the patient prefers not to speak during the procedure. And D. When the patient is shy or introverted but understands English well. The answer is A. When the patient speaks a different language and there's a significant communication barrier. Number 109. What should be the focus of education and information provided to patients before a phlebotomy procedure? A. The detailed anatomy and physiology related to the procedure. B. Complicated medical terminologies and concepts. C. Practical information, preparation, and what to expect during the procedure. D. uncommon potential complications to make them aware of all possibilities. The answer is C. Practical information, preparation, and what to expect during the procedure. Number 110. What principle should guide a phlebotomist's communication with colleagues and other healthcare professionals? A. Openly discussing patient cases in shared spaces. B. Using informal jargon and shortcuts in professional communication. C. Maintaining a focus on patients' welfare and effective collaboration. Or D. Sharing opinions about the patient's attitudes and behaviors. The answer is C. Maintaining a focus on patient welfare and effective collaboration. Number 111. Which approach facilitates constructive and empathetic communication with a patient who has received distressing news? A. Avoiding the patient to give them space. B. Offering generic reassurances without acknowledging their feelings. C. Being present, listening actively, and offering appropriate comfort and information. D. Rushing the conversation to prevent emotional displays. The answer is C. Being present, listening actively, and offering appropriate comfort and information. Number 112. How should a phlebotomist manage a situation where a patient is refusing a necessary blood draw? A. Use authoritative language to insist on the procedure. B. Listening to their concerns, providing information, and exploring alternatives or compromises. C. Ignoring the refusal and proceeding with the blood draw. D. Threatening consequences for their non-compliance. The answer is B. Listening to their concerns, providing information, and exploring alternatives or compromises. Number 113. Which of the following is important in ensuring clear and effective communication on the phone when scheduling a phlebotomy appointment? A. Use a rush tone to encourage quick responses. B. Speaking clearly, listening actively, and confirming details. C. Using medical jargon to ensure the conversation is professional. And D. Avoiding questions to reduce the call duration. The answer is B. Speaking clearly, listening actively, and confirming details. Number 114. What is a fundamental aspect of ethical communication in phlebotomy? A. Sharing information based on personal opinions and beliefs. B. Ensuring honesty, accuracy, and integrity in information exchange. C. Tailoring information based on what the phlebotomist finds suitable for the patient. And D. Utilizing persuasion techniques to influence patient decisions. The answer is B. Ensuring honesty, accuracy, and integrity in information exchange. Number 115. What should a phlebotomist avoid when communicating information about a blood test and their purposes? A. Using terminology that is clear and understandable to the patient. B. Providing a space for patients to ask questions and express concerns. C. Using technical language that might be confusing or intimidating. And D. Encouraging patients to do their own research and form conclusions. The answer is C. Using technical language that might be confusing or intimidating. Number 116. How should a phlebotomist handle a patient's questions about the meanings of specific test results? A. Providing interpretation and diagnosis based on the results. B. Directing them to discuss the results with their healthcare provider for a detailed explanation. C. Offering vague responses to avoid giving incorrect information. D. Encouraging them to ignore the results and wait for the provider's call. The answer is B. Directing them to discuss the results with their healthcare provider for a detailed explanation. Number 117. Which of the following reflects the effective communication during introduction phase of patient interaction? A. Using a formal and authoritative tone to establish dominance. B. Avoiding introductions to save time. C. Clearly introducing oneself and explaining one's role in the patient's care. And D. asking personal, non-medical questions to establish rapport. The answer is C, clearly introducing oneself and explaining one's role in the patient's care. Number 118. How can a phlebotomist foster a sense of respect and understanding with a diverse patient population? A, by treating all patients uniformly without consideration of cultural differences. B, by adapting communication and care approaches based on individual needs and backgrounds. C, by prioritizing the phlebotomist's own cultural practices in interactions. D, by discouraging discussions or expressions related to cultural practices. The answer is B, by adapting communication and care approaches based on the individual needs and backgrounds. Number 119. How should a phlebotomist respond if a patient expresses dissatisfaction with the care received? A, defending their actions vigorously to prove the patient wrong. B, listening empathetically, apologizing if appropriate, and taking steps to address the concern. C, ignoring the feedback since the patient is not a healthcare professional. D, informing the patient that complaints should be directed elsewhere. The answer is B, listening empathetically, apologizing if appropriate, and taking steps to address the concern. Number 120. Which statement about communication in phlebotomy is true? A, technical skills are far more important than communication skills. B, good communication can enhance the patient's experience and adherence to care plans. C, effective communication primarily involves speaking clearly and authoritatively. D, listening to patients is unnecessary as it consumes too much time. The answer is B, good communication can enhance the patient experience and adherence to care plans.